I'm Eric Johnson from the Center for Digital Strategies, and I'm here today with Eric Cowperthwaite. He's the CISO of Providence Healthcare, and he's been here today at Tuck as part of a workshop that we're running at Dartmouth called Securing IT in Healthcare. And we've been having a wide-ranging discussion today about some of the issues around security breaches, usability, workarounds, all the kinds of things that happen inside of healthcare environments that sometimes can make data vulnerable. And today I just wanted to chat with Eric a little bit and have him tell you a little bit about his view on usability, and particularly, why is usability in healthcare linked to security?
What happens with our electronic systems when they're more difficult to use or cause especially our back office employees to not be able to do their job effectively, what they do is find ways to get around it. It's not so much that they want to do something bad as they want to do something good, which is do their job well, and so they work hard to get around it. They extract data out of the system into an Excel spreadsheet, or they print the screen so that they can take the data with them to do their job. And what happens then is that the normal security controls that we've built into our large clinical systems are completely ineffective at that point, because we've taken the data and moved it somewhere like an Excel spreadsheet on a desktop computer.
So when you compare this to other security issues you face, how big of an issue is these kinds of usability or workaround issues?
Well, so if we take a look at some pretty recent news, it's big. Last fall, Sutter Health had a desktop computer stolen out of an office environment. You know, somebody broke the window, probably threw a brick through it or something like that, stole the computer, and most likely the computer was stolen to take to a pawn shop and get $25, $30, whatever for it. Unfortunately for Sutter Health, someone in their organization had put about 4 million patient records onto that computer, undoubtedly to do work that would be important to Sutter Health. But in doing so, they put it onto an insecure system that was stolen, and that has led to a lawsuit against Sutter Health for about $4.5 billion.
Wow.
So that's the size of the problem.
Yeah. That's a big problem.
Yeah.
Well, you know, today we've been talking about some of the changes in healthcare. If you look on the technology side, just the amazing changes of moving from paper to a full-fledged EHR in a very short period of time, the changes in the technology landscape around consumerization and cloud and these kinds of things. And all of these seem to be creating, you know, some real challenges for security in healthcare. But we've also been discussing some of the research possibilities or potential development changes. What struck you as some of the potentially impactful research that could be done in this area?
You know, I think one of the most impactful pieces of research we can do is around how to better from a technology perspective, how to improve that usability interface, how to make what we're doing look more natural, feel more natural, be more usable to our clinicians, to our back office users. I think the other area of significant effort is in how to, I call it the 1% change. How do we move the dial 1% on our culture of healthcare around security and confidentiality of patient data? How do we inculcate that into what our clinicians and back office employees are doing every day?
Yeah. Is that education? Is it a culture change? What is?
I certainly don't think it's our traditional, here, take your annual compliance education course. Not that that's bad. Don't misunderstand me. I think that's important for a couple of reasons. One is to demonstrate that we are doing what we're required to do, but the other is it does reach a good chunk of our users at least once a year. But I don't think at the end of the day that that's going to bring about the changes we're talking about. And so I think it looks more like cultural change than taking yet another training course.
Yeah, that's perfect. Well, Eric, on behalf of all the conference organizers, ISTS, Dartmouth College, Tuck Center for Digital Strategies, thanks so much for being here today.
Yeah, absolutely. It's been fun.